That is a hot take.
Yeah, I know.
I think I would not be willing to gamble losing my other eye.
You can't see it with the eye. The first thing she did is she grabbed her phone and made a TikTok on it. If you could see these lid margins underneath the microscope, you would probably never wear fake eyelashes again.
If you have issues with blood sugar, you just go into the forest and get bit by the Gia monster and you're good.
Can you do it?
I can.
Do it right now.
So unnatural.
Oh my God.
So we're back today with episode 2. Alongside me, Dr. Williams, and always Amanda. Holidays time, right?
That's
so
it.
Much like everybody else, I think I spent a lot of time on Amazon and searching through. I came across a product called Iris Ink. You ever hear of that?
I have. That's kind of the new talk in eye care, or at least from like social media standpoint. Drops that apparently change the color of your eye within 2 hours and can last up to 10 hours.
Seems safe.
That's not safe at all. I was looking at that a couple days ago, and there's really no preservative in the drop. So number one, it's not lasting long term like the label says it does, and there's no differing ingredient from one color to another. So if you're buying the honey versus green, there's no difference in ingredients. So I don't know how it changes the eye color.
It's like 10 milliliters. That's a big bottle. There's no preservative in it?
No, I think it said it was made of purified water, calcium, magnesium, and glucosamine, none of which is used in eye care for drops. And there's no data on how it works or any side effects.
And there's no change in ingredients in there. So how does it,
There's
honey versus green?
There was nothing that I could come up with or find that showed like a difference between the
Oh,
two
it says
different colors.
lighten and brighten your eye color. So maybe like if I have brown eyes, I would buy the brown, and it would lighten my brown eyes.
Yeah, but how?
Is that? I don't know. I'm
That's
just
that's
saying.
what,
Is
that's
that?
what our question is.
I don't know. It has terrible reviews though.
What's the reviews? What's it showing?
Let's see. This does not work at all. Save your money.
That's short and to the point.
Burns for a few seconds. They don't really do anything. I'm bored and want to try it. It stings your eyes. Yeah, so they don't really work.
I always find that Amazon's fairly reputable. I wonder how this even, it's probably not FDA approved.
It is
How does
definitely not FDA approved.
I feel like this is badness waiting to happen here with no preservatives, people trying to change their eye color, and then you're going to end up seeing infections and ulcers.
Yeah, and there was another part that I had seen that said, it may wear off if you're not using it regularly, so it encouraged more like long-term use. So just with the non-preservative formulation there, that's really just setting someone up for eye infection, some sort of vision loss.
And they're going to catch people too, because it's under $9. People will try for $9.
Sure.
Change my eye color.
Absolutely, or buy it in bulk.
Yeah, people are doing a lot of crazy things to change their eye color. Like, Amanda, have you ever looked at your eye color and be like, I hate my eye color. I need to change this?
I mean, I prefer if I had green eyes, but I would never think to change it, no.
But why
I know you can wear color contacts, but that just seems like a lot of work.
Why green versus blue versus honey?
I mean, green is just prettier than brown, personally, in my opinion.
But they made a song about the brown-eyed girl.
They also have blue-eyed girl. Green is the most rare, isn't it?
Brown would be the most common, right?
But the least common is green, right?
I'll be honest with you. When a patient sits in front of me, I don't really...
You don't look at someone and say, wow, you have beautiful eyes. You've never come across a patient.
I say that on a daily basis.
Okay,
but it doesn't matter if they have brown eyes or blue eyes. Maybe a blue-eyed person
You don't have a preference?
I would not look at somebody and discount them because of their eye color.
Yeah, I agree with you on that.
But yeah, people do a lot of things. There's even surgery that keratoconus pigmentation where you've heard that one too, right?
Mm-hmm. I don't know anyone that does it.
So it is not FDA approved. And so it's been done for years for like somebody that had like an eye injury and maybe their cornea is scarred over. They can do kind of handheld. They can actually do almost like a tattooing on it to create a pupil.
Mm-hmm.
But now, I think it was like in New York, there was a few surgeons that were doing it, and they use the femtosecond laser, and they create all these little channels in the cornea, and then the patient selects what color pigment they want or what color iris, and they create a new iris color for the patient.
And they were doing that even just for pure cosmetic without having any like corneal scarring or haze.
Pure cosmetic, yeah.
Mm-hmm.
But for the reason that they just wanted to change eye color, not because they had a scarred over cornea that looked bad. These were people with normal, healthy eyes just electing to change their eye color.
People like Amanda that want to have a green iris or And they took it to the next level. But I guess before you would go to surgery, there's risk of infection. There's risk of a lot of different things where, it's going to take away your optics of your eye. Your pupil, there's a reason why your pupil gets bigger at nighttime. It's allowing more light in there. Maybe that's going to cause a decline in vision at nighttime, and you're not going to have good vision.
You wouldn't have a clear cornea for light to go through anymore.
Right. So I really wonder what these people are going to have down the road.
Sure.
And I know you can do, like, for skin tattoos, you can remove that if you don't want it, but...
Could you reverse the eye color?
Corneal transplant, I'm going to guess. I don't think that you can actually, because if you're putting little holes or little channels in the cornea and you're applying pigment to it, how do you reverse that?
How do you take that out? Like, it would just stain. I feel
like
it would be...
don't do that, correct?
I wouldn't
You would not recommend.
I wouldn't do it at all.
No. I feel like I would rather just go for, like, a colored contact, because you can get those in all different sorts of colors and shades.
Right.
And if you don't like it, then change the color.
I love my eye color. I think it's great.
You have green, don't you? You have the rare color.
They're kind of like a hazily green. I am rare.
You are rare.
Or even with the going back to the color changing part, people get contact lenses online, color changing contact lenses, which they are color lenses and they've been out for decades and they do well when we prescribe them. But some people are getting them from like salons and beauty accessory places,
costume stores.
Have you seen that? Have you ever gone to like a hairstylist or something like that and they offered you that?
Mm-mm.
I know people have gotten it from these places and
we've
just
seen
give
people.
it to them. And the issue is they get the contact lens and they get like one. They don't really know how to take care of it. It probably doesn't fit their eye, first of all.
It's not like a daily, or it's just like you could wear it forever, or
no contact lens can be worn forever.
Well, it's not. Yeah, it's not specified.
Yeah.
And so people will put it into like maybe a solution. Maybe it is a legit contact lens solution, and then maybe they wear it a month later. Maybe they wear it 6 months later. Well, the solution doesn't last forever.
Don't you have to change it every day if you put it in solution?
Well, you should. The contact lens solution will last, a few days. What would your take on it? You do way more contacts than I do.
I've always told people if you're going to go more than 3 days without putting the contacts in, you should really dump out the solution, fill up with new.
Right.
Yeah, every 3 days.
And then there's something called topping off where I could see people maybe like the solution evaporates a little bit, so they keep on topping it off. So you're not really changing the solution. There's still bacteria that can grow into that case, and you're just going to cause problems.
What about that? Has the red cap?
Clear care.
Yeah. Does that have to be changed every day? Hydrogen peroxide ones?
It's hydrogen peroxide, so that has to be used with its unique case. There's a little catalyst at the bottom,
had that,
so you can't just put that in a normal case. But after it sits in there for 6 hours, it turns into saline solution. Even still after that, it's not going to last forever, right? It's sitting in saline solution.
Say 2 to 3 days ago.
Right.
You should repeat that process.
The hydrogen peroxide in that solution is going to last longer, but it's when it's in that case and changes that saline solution, it's not going to last forever. You're just putting yourself at risk.
I've had one person in the last 4 years that got a lens from a costume shop, and they had no clue what it was, and they never even wore contacts, so I don't even know really how they got it in their eye and how they were taking it out, but they did bring it in with them for their exam, just saying, oh, like I have this, is it okay? And they did put it on, and I mean, it didn't move on that eye. Like it was so suction cupped, and they're like, it does feel like kind of sore, but I just deal with it because it gives me the cool like cat eye effect.
Right.
And I was just like, no, please stop. There is like an actual manufacturer. Like I can specify the shape, the size, the material. We can customize it, and it'll be cheaper for you in the long run because you're less likely to go blind from it.
Right. Now, again, you do a lot more contact lenses than I do. There was something called Wild Eyes years ago that was like the costume ones where you can get, an 8-ball on your eye. You can get the cat eye, an all-white eye. Do they still make those?
Yeah, I don't know that particular.
It was called Wild Eyes.
Wild Eye.
That was years ago.
There's a company called Orion. They have all sorts of specialty lenses, costumes, color changing, totally opaque ones for pupil and iris anomalies. So I like them because you can specify again, what you're looking for, and you can even like send in a picture to kind of guide what they're going to design for you. So for like color matching a patient, I just did this not too long ago. She had an iris tear after a cataract surgery. And she got like 2 pupils now. So I sent them a picture of her normal eye and then the picture of the iris anomaly eye. And that was really just like color match, because the whole point of that type of lens was to not draw attention to the eye with the change, and did a really good job. She could have went to a store and said, oh, that looks like kind of my eye color, and could fix it, and it could have just been bad news.
How do you tear your iris?
They could have had some complications with the cataract removal, and maybe just a little bit too much energy was put in the eye, or one of the hooks could have maybe did a little tear. It happens. It's unfortunate. And
there's some patients that their pupils just don't dilate very well for surgery, and they can do these malign rings and hooks. And sometimes in the old days, when those weren't even around, there's a phaco tip, so the tip that actually would kind of use the ultrasound. It would sometimes get close and hit the iris and disfigure the iris. But some people are born with like coloboma. They're missing part of their iris. There are some patients that have just blunt trauma, and they can develop a tear.
Like that, or is that not real?
Yeah, that's kind of what the situation looked like.
Yeah, and that probably is not from cataract surgery, because the cataract surgery you would see if there was any trouble, because with cataract surgery you go through the pupil. You could get maybe like the margin of the pupil would actually become a little bit distorted. That there is like aerodialysis, where that's probably from trauma, like a blunt trauma, something hit the eye, and that.
Does that mess with your vision, or can you still see normally?
Let's just say that patient is never had cataract surgery and they have their normal human lens. Two different things. When you have that type of trauma, you're probably going to develop a cataract. But the second thing that's really an issue with that big gap there, light's going to get through the iris, and it's going to catch the edge of it, and it's going to create a lot of glare-related issues. So that's where maybe like a true customized colored contact lens, one that can block out the light, you can actually decrease the amount of light coming in, and you're going to have less glare problems. But yeah, so on a patient like that we just showed, like there are a necessity for a colored contact lens.
For sure.
My 2 cents, I'm not a huge fan of changing iris color just to change the iris color.
Yeah, I think it's unique to everyone. I feel like it's always like a slightly different variant or shade, so I wouldn't ever want to change my eye color.
What toys or what things have you seen with kids that cause eye injury?
Nerf anything. I've seen corneal abrasions. I've seen retinal detachments. I've seen a traumatic iritis. Nerf, just a no.
I agree.
Nerf or nothing. Nerf or no.
Nerf or no.
Yeah.
No.
I will say I've seen a lot of Nerf gun related injuries, and I'm not going to lie, I bought these for my kids too. And
sure.
We had fun battles in my basement. I will say they did wear safety glasses.
There you go.
We all wore safety glasses.
You wore safety glasses with the Nerf?
Yeah, because all these injuries. Because it's just not a Nerf like little.
I mean, they're soft if you're far, but I guess if you like got hit up close, that would.
When's the last time you saw a Nerf gun?
I have little cousins, maybe like a couple years ago.
They've changed. They're just not like a foamy Nerf.
Well, they have like the like
little suction.
The rubber.
The
There's a rubber harder tip to it. Pull up a Nerf dart and you'll see what I'm talking about.
Okay, but like,
think of that going right to the cornea.
Yeah, like.
Well, it's like the little rubber.
And they come out pretty good velocity, so if it pops you in the eye, patients get hyphemas. It was probably a couple of years ago I had a call. It was shortly after Christmas time. The Nerf gun was blocked, or the bullet was jammed in there, and the kid was trying to get it out, so he was like looking directly down at it, and it popped him right in the eye. They're a lot of fun. I'm not saying anything bad about them from a fun scale, but they can cause some eye injuries. I would wear a safety glass when it comes to that. I don't know if this would go underneath toys, but exercise resistance bands. Anything that has...
Really?
Do you know what I'm talking about? Yeah, people do
like
those.
Come back and smack you in the face?
Yeah. They get this rubber band slapped to the eye. Absolutely.
What does that do?
Depends on like how hard it hits and
like if you're like on your foot, you're pulling it, and then it goes...
It can cause a lot of different...
like
I
would never think that would happen.
So this, again, a few years ago, was my next door neighbor's daughter had that injury. And she just developed an iritis, so she developed inflammation to her eye, and she did well. But I've seen people have like a hyphema, so their iris...
What's that mean?
The front chamber of their eye starts... You see blood in it. That should be just a clear fluid, but you see red blood cells in there.
So like visually, it would be like you have like a bloody eye?
So you could look in the mirror and see, like say a person had blue eye, you'd really see the contrast. You would see the red blood cells starting to stack. You'll see them actually a layer of blood in the bottom part of that chamber.
Gotcha.
Or sometimes it could fill the whole entire chamber. And then even more so, just that amount of trauma, you can have like a retinal bleed, retinal detachment too. So now for sure you're going to have visual changes.
So don't work out.
Yeah, that's the moral of the story. Don't work out.
You know, I just thought of another one while we're sitting here. And it's what we do for everyone's birthdays.
Silly string?
With the silly string. What if one of us accidentally sprayed someone in the eye?
Is that like more like a chemical, like?
Yeah.
Probably like more of a chemical burn, if anything.
I imagine.
But I just thought of it, just getting in the eye. Good thing we know maybe a few people that could help us out.
Right. It probably wouldn't cause as much like retinal detachment or like that.
Sure.
That
like
trauma.
burn.
But maybe like a little chemical burn, irritation.
Or it kind
sure.
of comes out more of like a aerosol liquid at
If
first,
it
and then it
doesn't,
starts to
yeah.
like firm up. So
Right.
then it could maybe like harden up while it's on your eye and have like a foreign body in the eye.
Now I know I have a couple of years on you guys, but there was a game like more so like in the 80s. It was called Lawn Darts. So it was essentially
Lawn
took,
darts.
I don't know, probably about a 10-inch dart, and you would throw it and try to get it in. It was kind of like
Like a metal
the
dart?
version of cornhole 30 years ago.
But they're like
yeah.
metal?
Yeah, it was a dart. It was a dart tip. And it was kind of weighted, so you would throw it, and then the dart tip would always land in the ground. But that was kind of like the thinking years ago. Our parents would say, Johnny's 7 years old. He's responsible. Go throw this dart in the backyard. What could go wrong? I'm sure somebody had to have an injury with this thing.
And I'm sure they had some weight to it too.
But what about this new trend of axe throwing? What could be worse than axe throwing? They incorporate alcohol with it too. So why not? They start drinking beers and like, throw an axe.
Yeah.
Someone threw one at the axe throwing place. It hit weird, bounced back, and it like almost hit me in the face. Like it came fully back.
You see the videos?
Yeah,
it bounces
it's
back.
crazy.
Mm-hmm.
I do not like
You're
that.
just there, right?
Yeah,
There's no
and
screen.
You can't there's no screen. There's nothing.
Yeah, it's not like you're behind a
there's,
fence and you're kind of throwing. If it bounces back, you can
Well,
hide.
if it hits wrong, it'll just come straight back.
You did axe throwing?
I got a bullseye. Thank you very much. And they have like the ninja stars too that you can throw.
Oh, I've not seen
Where I
the
went,
stars.
they have the ninja stars. I was like, this is too
Did
much.
they bounce off the wall too?
Not as bad because they had like spikes on all sides. But it was in Texas. Maybe they have different rules there.
In Texas, you think you're tough, but when Texas gets 60-degree weather, are they wearing like winter
They
coats?
would call work off. They'd be like, there's a slight chance of frost. Everyone stay home. Be safe. I'm like, we have 2 feet in Michigan.
Could you imagine that if it was like that here? We'd work like a week or two throughout the winter season.
Well, they also don't have like the salt trucks and stuff, I guess.
Sure.
That's their excuse. Like they don't have the stuff to put on the road, but.
Well, around here, we don't really have that either. It seems like you just got to drive.
I guess.
They do it. They fix it at like 5 o'clock in the evening after everyone's already gotten to work and almost home.
I would say like, we would get 2 feet in Michigan and they couldn't even fathom what that looks like. It's like 2 whole feet of snow, and you have to go outside. I was like, yep, we go to work.
My first year away at Ferris, I will never forget. Like that was a really long winter. Like it started and it just didn't stop. Mm-hmm. And there was one day that I had to walk to class. Ferris is known to like never cancel class no matter what the weather is. You deal with it. But the news in the morning said you are at very high risk of being frostbite if you were outside for more than like 7.5 minutes because it was so cold. And then with the wind, it was even colder. And my longest walk on like a normal nice day was like 12 minutes. So now I was like, it's going to be probably closer to 20 trudging through the snow. So I was like, that's really nice. And then when I did get to the class, my scarf from me like kind of like breathing into it was super like firm, like it froze. And I had crystals in my eyebrows and my eyelashes. I just was mind blown. And I said, I'll never, ever complain about a Metro Detroit winter again after a winter on the west side.
And the west side is different because they don't salt the roads; they dirt the roads, right?
I don't know that they did anything there.
I don't know. I just remember being on the west side of Michigan. They would have trucks just spread dirt across the roads so you'd have more traction.
I wonder if snow days are really a thing anymore. If there's a more like, we'll just do like a virtual class today.
I don't know.
I wonder if there's rules with
That's true. And then I always said that. I'm like, COVID, and we could do everything virtually. So I go, we should eliminate snow days, right? These kids. No, it still exists. My kids had snow days last year.
Where there was just no school that day.
School canceled.
Nothing online or anything.
Nothing. And they cancel it like the day before. They go off to the meteorologist who has a 50-50 chance of calling this.
They have like the snow day calculator. I would always be looking. It's like 80% chance.
Yeah, they did. They did.
Wasn't there a school day or a snow day dance? You're supposed to like put ice cubes in the toilet and flush it and do a little dance or something.
It does sound
Flush
familiar.
some sort of like ritual. There's another thing that you might see on Amazon.
What?
False eyelashes. I just kind of thinking about the drops for changing your eye color. Just like in the cosmetic, kind of searches. That's something that shows up all the time. And I just think of seeing those behind the slit lamp. There's some people that take really good care of their hygiene, and there's no debris or anything built up. And then there's others that say, oh, these have been on for like 6 to 8 weeks, and you can clearly tell that they don't give enough attention to cleaning their face or their eyelids.
For sure.
Or they've been there for more than 6 to 8 weeks.
But there's a difference between false eyelashes and eyelash extensions. Because, like, eyelash extensions you would wear for a couple weeks, and they, like, glue them into your eyelashes.
Yes.
But the false eyelashes that you just, like, glue on, you could wear them for, like, a night for, like, a wedding. Is that still terrible to wear them, like, for a day?
So I think at the end of the day, when you put anything on the eyelid margin, you're going to potentially cause some irritation. You're not going to create as good of a tear film. To your point, I think just when you look underneath the microscope, some people do have a few. It's not overly done. There's like eyelash extensions, and it actually can look fairly clean underneath the microscope. But as Dr. Williams was saying, there are some people that they just have so much glue caked on their lid margin. And it's like they keep it on for a very long time. If you could see these lid margins underneath the microscope, you would probably never wear fake eyelashes again.
But for a day? Or still never at all?
It's been around for a long time, right? And like, I've not seen anybody have any major issue minus some people. There's 2 different versions, right? And you can correct me if I'm wrong, but you can put like a glue from a home remedy, if you will. And there's one that's like magnetic, but the glue one, people have gotten the glue in their eye.
Yeah.
And their eyes all closed in.
It's not great.
So, but I will say, if that ever happens to you, mineral oil does break up the glue pretty well.
I don't usually wear them, but I know people who do.
I feel like if you were using them for like a specific like event or night, I don't wear them. So, I mean, who am I to judge? But I feel like that would be better for like just hygiene purposes.
Yeah, because you take them off at the end of the day, like wash your face, wash your makeup off.
Or I feel like even if you have just like actual extensions put in, I don't think people know like you should really be paying a lot of attention to that area. So like those lid scrubs, like something that kind of foams to like kind of break up the debris.
Because I've never had extensions, but I think they say that you're not supposed to get them wet or like wash them. That's like part of what they tell you.
How are you supposed to shower then?
You just cover your face.
I think cover your
but that's probably why they get so gross, because they're like, don't rub them, don't touch them, don't clean them. So that might be part of the issue.
Well, the eyelash extension, I feel like there's just a few like eyelash fibers that are attached to them, and it just enhances their initial look. Some people have eyelashes that I feel like they're like 2 inches off their face that are nowhere near a natural look, and it'll hit their eyeglasses. It's that far off. Eyeglasses typically sit like 13, 14 millimeters off your face, so it's they're that far out there dragging against it.
My glasses are never clean.
Right. And or maybe they are. They're constantly dusting it.
They're constantly dusting it. Little glasses, windshield wipers.
I don't even know. I've never really looked into it. People come in and they have them on. Are they like a one-size-fits-all?
So usually, it's one size. It's pretty long, and then you can cut them based on like how long your eye is.
And then so
you cut them to size.
And when you're online looking at it, do you dictate the size? Does it say like 6 millimeters or 10 millimeters?
They don't give size in length, but it'll be the lashes. So it's like, you want wispy lashes. Do you want a super full dramatic lash? So it's like the number of lashes.
When we diagnose people with glaucoma, one of the first lines of medications that we utilize is a prostaglandin medication. One of the main side effects is eyelash growth.
Isn't that how they found like lash serum? Like Grande Lash?
Latisse is based off of like a prostaglandin glaucoma medication. Absolutely. And they swab it across it. Now, it can cause pigment changes. So if you get a lot of that on your...
Don't use the ink. Just use some Grande Lash.
There you go.
Maybe you put Latisse in there. Because it does. All right.
But you can't choose the color. It's just...
No, but a side effect of the glaucoma medication, it typically makes your iris darker. So if you have a light brown eye and you want a darker brown eye, glaucoma medication will work for you.
There you go.
That is truly proven.
There you go.
So I want lighter eyes.
Everyone just prophylactically gets treated for glaucoma to change your iris color.
So maybe that's the next thing. We have to come up with a glaucoma drop to make people have green eyes or blue eyes instead of just darker eyes. So speaking of eyelashes and then glue on the eyelid, Amanda's putting up a video. Have you seen this video?
I have not.
Okay, let's see.
My God, y'all, I thought I grabbed eye drops. Look what I just put in my eye and dripped down my whole face. Eyelash glue. And it's like time for me to leave for my birthday dinner. It's all over my face. I can't open my eye.
That's terrible.
So two things.
Wait, do you want to see this? This is the follow-up.
Okay, at least we've got eye movement, but
All her eyelashes got ripped off.
glue is, my skin is just,
It was nail glue?
bless her heart. My eyes opening, thank you God, but like this is my
Terrible.
skin.
That's literally my worst nightmare.
Two things. So you're putting all this glue on your eyelid.
Well, she didn't mean it.
Okay, she did not. She didn't mean it, but it's uncomfortable. Your eyelid's closed and you can't see the eye. The first thing she did is she grabbed her phone and made a TikTok on it. Yeah, I can't see, but where's my phone?
Maybe she was going to show it to her doctor later.
Yeah, she was recording so she could show.
Recording for her doctor.
Yes.
Gonna
that's
send
what she
him
was
a
doing.
message
And
and say,
accidentally,
"Look."
because she couldn't see, hit upload to.
And she said it was nail glue, right?
It said nail glue, which is essentially super glue, I'm pretty sure.
I get that, but she said she thought it was eye drops.
The bottle was similar,
Was it? Okay.
but it would be kind of hard to mess that up. I will agree.
I will say she's not alone. And people have come into the office, not with just fake eyelashes, glue, but other people have gotten glue into their eye, mistaking it for other eye drops. Super glue, one of them. If I could give one message, I would say do not store your super glue by any eye medications, your glaucoma drops, your contact lens solutions, or whatever it should be.
How do you get your eye open then? You said mineral oil?
Mineral oil. That would be my best advice. It's the only
Anything
thing.
else? Like if you don't have that, like let's say you're at home, you don't have that on hand.
Yeah.
What if you don't have it?
Don't pick up your phone and do a TikTok.
What if I
Use
use
the other eye and drive to.
Call your best friend and say, "I need mineral oil. Help me."
Yeah.
Do you just if they came into the office to do that? I'm pretty sure we have mineral oil in the office for that purpose. But do you just tip their head back and just soak it?
Yeah.
Or do you put it on a cotton gauze or something and just kind of let it absorb?
On that little bottle of the mineral oil, I
Yeah.
just put it on like a sterile cotton tip applicator and just kind of swab it on their eyelashes to try to break it open to eventually get their eyelid open.
Never had to, and I hope I don't have to do that.
Yeah.
But
But now that we talked
know.
about it, it's probably going to happen tomorrow for you.
I really hope not.
I haven't had one
I'll feel
in a few years, but the mineral oil will kind of help break it down.
Can that cause damage to your eye, obviously?
It's going to cause a chemical issue to your cornea. So, when you get that glue in there, you get it on your fingertips. You can't even move your fingertips. So when it gets on your cornea, it's going to cause the skin of your cornea to lift up. You'll probably create an abrasion. And, it's going to hurt. And you should go see an eye doctor if you have that issue. And then you can make another TikTok at the eye doctor when you're in the waiting room.
Come with me to the
your
eye
whole
doctor.
process.
I think of tearing the skin right around too, as you're opening,
Yeah.
and your eyelid skin is very thin and very sensitive, so that might even hurt more than a corneal
And
issue.
then we have all these glands on our eyelid that create oil for our tear volume, so those are going to get clogged up as well. So mine is opening up the eye, which would probably be the most important part. They likely need to be on some eye drops afterwards. I would imagine an anti-inflammatory and antibiotic afterwards. But I understand why people try to make their eyelashes look nicer.
Sure.
Because when you look at somebody, the first thing you ever recognize is maybe their smile or their eyes. And Amanda has a video here or little pictures of different eyes of celebrities. And we're going to see if we can figure out who they are.
Just based on their eyes?
Just based on their eyes.
Do you know who they are?
I do not.
So we're all going to try and guess?
Yeah.
Let's see. So these are all famous people.
Yeah.
Okay, if you know it, shout it out. It's going to zoom out.
It's a guy.
Okay. His
I'm
bushy
really bad at
eyebrows.
naming celebrities.
Oh.
Right. Pause. Tom Cruise.
Tom Cruise! Yup.
Ooh.
Pretty good.
That was good. All right, hit pause. Hold on.
I feel like I know, but I'm trying to determine how old based on the wrinkles. Is it hold on, we gotta go a little more.
Lindsay Lohan.
No. I'm going Emma Stone. I was gonna say her before I saw.
Yeah.
I should have known. I knew it was
Way
her.
off. Tyson.
Morgan Freeman.
Morgan Freeman.
Morgan Freeman.
It's Morgan Freeman.
I could tell he has those little like skin tags, doesn't he?
I'm with Mike Tyson.
Mike Tyson. It's Morgan. Come on. That was an easy one.
Yeah.
Oh, what?
It's kind of
feel
blurry.
like
Photos are kind of bad.
Hold on. Let me.
It's definitely
It's definitely what?
nothing. Anyone?
No.
He's got.
I had
No,
not-
I am. No.
Is that my mom?
Well,
Aw, shout out to
hey,
Jody.
Jody. How we doing?
Like, is that my mother? We do have the same eyes, apparently. That really caught me off guard. Okay. Sorry, guys.
Amanda's dad.
That is not my. He does not. He does not have eyebrows like that. I'm still shook. Oh, okay. Who is this? I feel like I know. Anyone.
Nicolas Cage. John Travolta. Nicolas Cage.
It's Nicholas, yeah.
Is it?
Yeah.
Oh.
Yeah, good call there.
He does have those eyes that really look to your soul. Wow, my mom, I can't believe you put her in there.
Well, you better get her a nicer Christmas present this year if you couldn't even
Then
recognize her
what?
eyes.
Well, it was kind of blurry. I'm sorry. You know what I saw someone do the other day? They flipped their eyelid.
Oh, boy.
First of all, why would you do that? Second of all, is that not so bad for your eye?
I can't do it personally. My kids can do
Your
it.
kids, oh, it's so gross.
Yeah, people do it. My kids have done it all the time. Can you do it?
I can.
You can?
I can.
Just like that, boom?
Yeah.
Do it right now.
Really?
Yeah. I won't look. I can't.
It's so unnatural.
Oh my God.
See?
That's a lot.
It feels so unnatural, but it doesn't hurt.
Right.
I just think of when I was like a little kid, people would do that, and I'd be like, you little freaks.
Right.
That's not normal.
So that just proves no matter how old we get, we still have that still an 8-year-old kid in us, right?
Yeah.
To your point, it would not be good if you kept on flipping your eyelids in and out. You're going to stretch that tissue a little bit. So I wouldn't recommend it. But speaking of that, did you see like that Instagram reel or was on TikTok about the Lions player? They're sitting on the sidelines. He had an eye injury.
Okay.
So Amanda's going to pull it up right now for us.
I've never really watched the Lions. And
Pause.
now I'm
You can't say that.
You've never watched The Lions?
Well, you didn't let me finish.
Okay.
Until this
Apologies,
season, I
apologies.
decided I was going to become a very dedicated Lions fan, and there's only one game I didn't see, and it was the game they lost. But every
So
other
you're our
game,
lucky charm.
I am the lucky charm.
Right. Well, there you go. Let's check out these guys.
Sorry.
You know how, like, when as a kid you used to play around and flip your eyelids? My eyelid was flipped. So on my life, I couldn't see. I'm like,
Watch this guy.
am I eye good? I flipped my back in the middle of the play.
He said it himself. It's
Yeah.
like when you're a little kid,
Yeah,
you flip the
kids.
eyelids.
See?
Can't that get like a lot of bacteria in your eye though when you're touching it like that?
Well, they're on the football field over there too. So yeah,
That's
you can get
bacteria.
something underneath their eyelid.
My hands were clean, by the way.
But
Absolutely.
Could you imagine even like the coach, right? He's a professional athlete. He's like they're getting these guys ready, and they're over there just flipping their eyelids
Just
in the
messing around.
sidelines. He's like, the guys sit there like this.
Yeah, he was a pro at that. He was definitely one of those as a little kid that did it then.
Yeah.
I was thinking back when we learned how to do that in school, and I honestly think that was one of the most difficult things to do because we were so scared to hurt each other practicing, and you've got to be like very, very careful not to pull out eyelashes too, and it was difficult, but now I can just flip them.
Right. Everybody in school, you had to flip every classmate's eyelid. So
Ew.
every eyelid got flipped. Well, my class had 32 students in it, so
Mm-hmm.
30,
Yeah.
31 times.
That's
Yeah.
disgusting.
For those at home, what's the easiest way to flip your eyelid?
In the clinic, if you need to flip your eyelid to make certain there's nothing underneath your eyelid, like a cotton tip, you can push against it, and then you just grab the eyelashes and just kind of fold it.
Ew. They did that to me once at the eye doctor. I almost passed out.
Yeah.
Oh no.
It was terrible.
Maybe you're not around any sort of healthcare facility. You're up north, and maybe you get something in the eye. And yeah, if it gets lodged underneath the eyelid, flip the eyelid. It could be like a piece of leaf or whatever in there.
So while we're on the topic of sports, what do you think are the sports that are most likely to cause an eye injury?
I would say Basketball, that has to be up there. Plus, last time, I remember that WNBA player got hit in the eye.
What about like a racket sport, like where like a ball could?
So years ago, and I
Fast.
don't think anyone plays this anymore, but racquetball used to be kind of dangerous. Everyone had to wear safety glasses for that because the racquetball could fit within the socket.
Is that with like the birdie?
Racquetball was like typically a smaller rubber ball that you'd be
Indoors,
like
on the
bouncing
wall.
it off a
Okay,
wall.
I know it.
The birdie, I think you're going with badminton.
Okay.
Or maybe hunting.
No, you know the birdie.
I'm gonna say
Hunting.
hunting is probably causes eye injuries too, right?
Probably.
I think
Shoot your eye out.
Are we gonna include that in your top?
Hunting?
Yeah.
Well, it could be. Remember the movie Wedding Crashers when Vince Vaughn and Owen Wilson are out there, and he's like, hey, about a quail. He's like, hey, you've known me for 17 years. I don't know what the hell a quail looks like. And then Bradley Cooper shoots him right in the behind. So I'm sure it can happen. I would say like MMA sports.
Oh yeah.
Okay.
Hey, those guys are
They're getting hit in the face.
they're getting beaten pretty severely.
Yeah.
And there's that one fighter, Shara Bullet. He lost his eyesight. It was like in a training session somewhere like out of the country.
So it wasn't even like in an actual fight?
It was a training or
just
sparring
training?
session that something happened. I don't know if he had surgery on the eye, but he lost his eyesight from
Just from like
trauma?
Trauma?
Michael Bisping lost his eye during a UFC fight and eventually became UFC champion a couple years later.
He lost his eye or his eyesight?
His eye.
His eye?
What's his name?
Michael Bisping.
Michael Bisping. He lost his eyesight in a fight and became champion.
Like, how did he lose his eye?
He
Like,
probably
it got hit out? Like, it came out?
No. He lost his
It got-
eyesight.
Oh,
So
he
probably
said he lost his eye. Did they have to do a nucleation?
Yeah.
So they removed his
Also,
eye.
to be clear, though, it's not like he was in the ring. He got hit and it popped out. It was
Okay.
just like bouncing around.
But they had to remove it eventually. Let's see.
So after he lost his eye, he continued to fight and he became champion.
I think I would not be willing to gamble losing my other eye.
Retinal detachment in his right eye after he got a head kick.
Well, most people with a retinal detachment still do not have to have their eye nucleated.
I'm scared.
Here it is.
There he is again, that left high kick, and Bisping is opened up and in all sorts of trouble. That'll do it.
That was that initial kick is what did it.
Wow.
He lost vision in his right eye.
Yeah, there had to be more to that.
I don't know. You had to kind of kick pretty hard. I mean, that or the 8 punches afterwards. One of them caused the detachment.
One of those caused the retinal detachment.
But to be clear, Amanda, if you get a retinal detachment, majority of people you can fix the retinal detachment. Even if the retinal detachment is chronic and they can't repair it, and the vision is not perfect afterwards, you typically do not lose the eye with the retinal detachment. So there had to be something else besides the retinal detachment that.
Maybe like a traumatic iritis or something, or an iris tear.
I'm guessing like the iris tear, vitreal hemorrhage, hyphema. The eye, I'm certain, was
Not
sustained
just
so much trauma that there's all probably neovascularization and the had hard times with the pressure control.
Yeah.
I'm guessing, and then he lost the eye. No, I said MMA. I didn't say boxing because after the Mike Tyson Jake Paul fight, I think those guys walked out there with 20/20 vision. No one really took a shot to the face.
That was lame. I feel like there were rules that Mike Tyson couldn't hit him because he kind of like went to punch and then stopped a lot of the time. I feel like that was suspicious.
A little sus.
Little sus.
Yeah, but they got paid.
Well, yeah, they got paid, but it was not interesting.
To just dance around.
That's what I'm saying. Like that doesn't seem normal.
I heard there was rules afterwards that they couldn't get knocked down within the first 2 or 3 rounds.
Couldn't he not throw an uppercut or something?
Historically, Mike Tyson's fights, majority of his fights, he knocked the guy down with within
that's
the
what
first
I'm
2
saying.
rounds. A lot of times the first
So
round.
he needed this to go on. He must really enjoy this still to be
He's 58. He's
volunteering to do that.
Honestly, I don't think he enjoyed it. Mike Tyson had a lot of money once upon a time. He lost all the money, filed for bankruptcy, I believe, and then now he's making his way back. I think he
made 20 mil, I
I
think.
did not know that.
Yeah, he filed bankruptcy a few years back.
He made 20 million from this fight, so I think he'll be good.
For right now. give him another year and have to fight somebody else. Trying to think what other sports, though, would cause. Not boxing.
Okay,
MMA.
give your top 5.
So I'm going to go basketball, MMA. I'm just going to bundle and say racket sports in general. I'm going to throw baseball in there, too. Maybe swimming. Maybe they get, maybe the chlorine bothers their
Oh,
eyes.
my
Gotta go
God.
swimming.
Okay, your top 5.
I think I would say basketball, football, wrestling.
What about hockey? I know
hockey.
Well, I know they have.
Of course. That's the whole point of watching
Well,
hockey.
it depends what year hockey you're talking about. But years ago, there were the guys, they didn't wear helmets. And then Detroit had a guy named Bob Probert that beat up everybody. So there was a lot of eye injuries just due to Bob Probert. Today, there's not as many fights. Everyone has, full mask over there.
But isn't it like a half? And couldn't the puck still go under, or it's a full mask?
So again, years ago, like some people didn't even wear anything in front. Like more people are having more eye protection today. And there was people, I don't know, maybe 30 years ago, 40 for sure, that did not wear any sort of helmet.
Okay, let's see the actual top 5 according to Google. Basketball number 1.
Ooh.
Baseball number 2.
Ooh.
For young people ages 5 to 14. Softball, field hockey, wrestling.
We were pretty good.
Wasn't there a young golfer, not too long ago that got hit, and now we're questioning if his career is going to be able to continue or not?
Yeah, Jeff Guan was hit on the golf course by a golf ball. So that's why it's really important if you play golf, especially with me, that you listen out for the person saying 4. There's a whole reason why they're saying it. Yeah, I can totally see, golf, depending which golf course you're on and who's out there, there's a lot of balls flying all over the place.
I have a really bad golf game. The Wii Sports golf actually kicked me off. What do you mean? It's possible. I was in the middle of playing with one of my friends, and it just
said you're done.
I was way above the strokes, and it just ended the game. And we were like,
it said,
what?
Shut down.
It literally just stopped. So I mean,
I was hoping Bryson would invite me over to his house so I could try hitting a ball over his house. Did you see that?
I don't know who Bryson is. Just Bryson?
You did just throw out Bryson.
You said, look, my friend Bryson.
DeChambeau.
This guy.
So he started this thing where each day he would get at one attempt to hit it over his house. On day 2, to get 2 attempts. Day 3, 3 attempts, and so forth, until you get a hole-in-one over his house. These guys are good. Now, when you golf with, like me, now that's where the eye injuries are going to occur.
Yeah.
Because I could aim one way, and it's not going to go that way. I try really hard, but it's not going to go that way.
Yeah. We should start that trend at the office.
Hitting over the office?
Yeah.
Well, we couldn't do the surgical side because that's a lot of glass. I guarantee you we'd have to replace
doing cataract surgery, and a golf ball just kind of flies through the OR.
Yeah.
You don't want to hit a patient when they're walking in.
No, we don't want to do that.
No. But if you're going to get an eye injury, what better place to be in a surgical center?
Do you think you could hit it over the building?
Hit it over our office?
Mm-hmm.
Maybe.
Our office is not that tall.
Like the surgical side? It depends on how far away you are.
Do you think you could do the entire length of the building?
Maybe multiple attempts.
I think in the summer we should test it out.
We'll invite Bryson over.
Yeah, so you can give us some lessons.
Yeah,
Bestie Bryson.
I wish he was. Give me a few pointers.
Absolutely.
So they just said Bryson's house is in Dallas. Do you think Bryson says pop or soda?
Probably pop.
Or Coke.
They say that in Texas? Do they say
Coke? Sometimes they just say Coke.
You've got the experience.
I'm not from there.
I know.
But I've lived there.
But you live there.
And they'll say, I want a Coke. And that could mean any type of pop.
So if it's like Sprite or 7 Up,
Coke.
It's a Coke.
I'm like, what does that even, how do they know?
So what if I order whiskey and Coke, but I really wanted it to be like a Sprite? How do you differentiate that?
I have no clue. I say pop, and they would say, pop? What are you saying, pop? I'm like, guys, that's not what you say. They say soda or a Coke.
I wouldn't like to say Coke because I think Pepsi is superior.
That is a hot take.
Yeah, I know.
I disagree.
You're the minority
I don't like
here.
either, but I disagree.
And then if you are adding flavors like cherry Pepsi, it's even better than like cherry Coke.
Negative.
I think you're in the minority. We should
okay.
take.
Let's take a poll.
We could take a poll.
Ask social media, Coke or Pepsi, soda or pop.
Yeah, the whole thing just saying Coke is just kind of.
It's just not right. They say a lot of funky things, and
I'd like to get a Coke, but I actually meant to say Sprite.
But so if you want a diet Sprite, you have to be like, give me a diet Coke, but give me the clear version.
I feel like they say, I could be wrong, but yeah, like I'll take a Coke, and they'll say yeah, like light or clear, like some other word defines that it's a Sprite and not a Coca-Cola.
So living in Texas versus up here in Michigan, is there any other like weird things like that we say or we do different here, like say in the Midwest?
Well, they obviously say y'all, and I refuse to say that. I would say, hey, you guys, and they'd be like, you mean y'all? I just doesn't roll off the tongue for me.
I say y'all like in a group text message, but I don't think.
But not like out loud. You say like, "Hey, y'all."
I have friends that live in South Carolina, and
There you go.
that's the y'all.
Or they'll
The
say
y'all.
like
I love
something
it.
nice, but it's an insult. Like here, if we were like, "Oh my gosh, bless your heart," that would be like us being genuinely nice. If they say "bless your heart" in Texas, they're like, "Oh, bless your heart," like you're so stupid. It's like an insult. Like "bless your heart" is like, "Oh, you poor thing."
I do know, like, when I've not been to Texas, but like if I went to Florida, like we were talking earlier, if it's 65 degrees, they are all bundled up in winter coats. That is true wintertime.
Yeah.
And I would like be like, "Oh, I live over here," and they're like, "What? Like, why are you doing that?"
Yeah, like
Because the mitten.
right. The other thing, I'm here in Michigan, Metro Detroit. That's where the bulk of the population, let's say, lives. But we say up north. Doesn't matter if it's like West Branch, Mackinac.
I'm always going up north, regardless of where it is.
Yeah. Even if there's a 10-hour difference between two places up north, it's up north.
And then if you talk to somebody up north and you ask them what they're doing this weekend or whatever, they're like, "Well, I'm going downstate." It's the opposite.
People in Port Huron, whenever we talk about like coming down to the surgical center, they'll be like, "Oh, I have to go into the city," and I'm just not used to that. I'm like, it's not that far, but you think of in relation, yeah, it's
Right.
into the city.
So before we wrap everything up today, one other thing I want to kind of go over. The weird things that medications have originated from, or how do people get to these medications?
Like their origins.
I'm going to say, for example, aspirin.
Mm-hmm.
Aspirin can come from the bark of a willow tree.
Okay.
Like you look at all these medications, like how do people know to explore the bark of a willow tree for,
Right.
this substance?
What were the events that led up to that discovery?
Exactly. Did someone have pain and they started eating the bark of a willow tree and they felt better?
Penicillin came from like a mold.
Right.
So like who was playing with molds? Just
Isn't
discovered.
it always by accident half the time? Like they're trying one thing and then they find out that it works for this.
Yeah,
feel like
there's
that's how a lot
I
of
think
it
a lot of
goes.
things in science have been just purely by accident.
Yeah.
There's a diabetic medication. I think it's called Byetta.
Mm-hmm.
Did you see where Byetta
No.
was originated from?
No.
Can you Google that? So Byetta actually is from the saliva of the, I'm going to pronounce it wrong, Gia monster.
Okay. What is a Gia monster?
You got to see the picture of this.
Oh.
So,
It's like a lizard?
yeah. I just don't understand. Like Amanda said, a lot of things are discovered by accident. But how does the Gia monster, how did they figure that one out? Did someone get bitten by it and they found that their blood sugar dropped?
Well, even if that was the case, like why was that being checked? Like just what? That's a very strange one.
Maybe check the saliva of a whale. What would that do?
Right.
Cure high blood pressure.
Sure.
Actually, there is. I believe it's ACE inhibitors.
Mm-hmm.
Comes from the venom of a snake. There is more
Sure.
out there. Yeah, that one came from the venom of a snake. So I don't.
Okay.
Again, did someone get bit by the snake? And they're like, wow, his blood pressure really
blood pressure
dropped, and
changed.
let's explore that.
I came across one that said one of the first medications for treating high cholesterol. It was a part of a insecticide, and it said these French farmers were getting really sick from exposure to the insecticides, but their cholesterol levels were really low. I just think, how does that lead to that?
Right.
And then here we go. That's a whole class of medications that have been around for 100 plus years now.
It's all by accident too. And then
It
these
is.
are like ACE inhibitors for
Mm-hmm.
high blood pressure. That's a main medication. Penicillin, like you said, it's a very common antibiotic. Diabetes, obviously, that's a huge
Sure.
industry as well. But I don't know what they're going to explore next, or by accident.
Maybe if you have issues with blood sugar, you just go into the forest and get bit by the Gia monster, and you're good.
Well, they do say like honey. That's like a natural antibiotic there too, right?
Yeah.
Manuka honey eye drops, those are a thing.
Yeah, I did see that.
I'm not very familiar with that.
They're literally eye drops.
They have like different percentage of the honey in it, but they kind of burn when you put them in.
What would you use it for though?
They market it for dry eye. Isn't it like naturally bacteria or something?
Natural antibacterial,
Microbial.
Everything.
inflammatory. It's
Can be used for a lot.
It's a great thing.
I had a patient last week who was a honeybee farmer in her retirement and for like a hobby, and she brought me a little mason jar of fresh honey. And I've never
Jealous.
had fresh honey. I've always had the store bought and that little bear,
bear.
the teddy bear, whatever you want to call him. But this is just pure raw honey, like fresh, and wow, it was pretty darn good.
And there's other advantages of like local honey.
Yeah, for allergens.
For allergies, right? So you're getting it from like the bees and like they're pollinating the local flowers and whatnot.
I didn't know that.
Yeah, I use it for that a lot.
Huh.
Do you feel
like seasonal allergies? Just buy like local to where you live.
Yeah, didn't know that.
Yeah, does it help your allergies?
Yeah, it does for me.
I'm terrified of bees, so I'll just take your word for it.
You don't have to harvest it.
Yeah. I know, you guys deal with it.
Yeah, we're not telling you to go out there with the little net over there and getting it.
Yeah, that's the only way to obtain honey.
I've heard of those drops. I've not really researched it, so I can't give a professional opinion on that.
Manuka honey comes from the nectar of a manuka tree. So that's not from a bee.
And that is what these these honey drops
yes.
they're marketing? Okay.
Mm-hmm.
How much is that now?
I think they were like $10.
And again, like the ink eyes, people will try, $10, people are like, what the heck? I'll give it a try.
I mean, we tried it.
Holidays are fast approaching. End of the year's coming up. Do you have any resolutions for 2025?
Yeah, it's probably the same one that I've had for several years now, but I feel like this is my year to do it. Just trying to be more aware of overall health and as far as like dieting goes, and trying to be more aware of additives and trying to eat more healthy and less carry out. Maybe some exercise in there too.
Yeah.
I will not go to the gym no matter how many times I'll tell you I will not go.
Do you have a membership?
I do not. I did. And they
that.
made probably a couple $100 off me because I had to go in to cancel it and I just didn't want to go back.
Take a walk outside. You don't need the gym. Yeah. Take a run, take a walk.
So how about you?
Probably the same thing. I signed up for an Ironman race and
you did not tell us this?
I'm kidding. You think I'm going to run the Ironman?
I was like, are you kidding?
That is like running, biking, and swimming.
Like hundreds of miles.
I'd have a heart attack at the first
do it.
mile.
You can do it. Come on, that's a great resolution.
That's a great resolution. I agree with you. It's not going to happen for me now. No, I would like to actually find more time. I need to find more time, allocate more time to actually going weekly and just keeping my health better too. I would say that, and also allocating time. This sounds kind of weird, just to have fun. Yeah, because I'm always on the run. I'm always doing something. Whether it's a weekend getaway, in a golf outing,
play some Keno.
I will
head to Art and Jake's.
But you got to remember, if we don't win, it's for the children. It's for the schools.
It's for the children.
Yeah, that'll be about it. I want try to keep myself healthy and actually allocate some time to have some good leisure activities. Amanda?
I want to get into reading a little bit more. Towards the end of this year, I've been reading, but I want to be better about every month, trying to read a new book, something like that. And then running more. I ran a couple races last year, but I want to be more consistent and more driven, so. And I hate running, so it's just good, like, mentally to make yourself kind of do something that you don't want to do.
We're out of time here for today. So, thanks for coming out for episode 2. Dr. Williams, Amanda, as always, thank you very much. And,
thanks for having me.
Thank you.
I hope you guys come out again and join us for episode 3.
Happy New Year.
Happy New Year. Happy holidays, yeah.
Same to you guys.